Xanax, also known as alp-alprazolam, is a drug which falls under the class of medications known as benzodiazepines. These drugs are used to treat anxiety, and in this video we will cover how and why they work, as well as the harms of taking too much of them in relation to the rising use of Xanax as a recreational drug. So Xanax is used to treat anxiety disorders. Anxiety disorders are defined as an unrealistic and unfounded fear that is produced from a combination of physiological and environmental factors. Now, you may think that anxiety is completely psychological and that people with anxiety disorders just worry too much, but it does have a biological basis which was discovered in the early 1900s, where leucotomy instruments were used to perform lobotomy on people with mental disorders. The aim of the lobotomy was to separate thought from emotion by separating the white matter from the prefrontal cortex. Surprisingly, this relieved the symptoms of clinical anxiety and showed that the frontal lobes of the brain are involved in emotional reactions and that anxiety may arise from a dysregulation of emotional states. Forward to today, it has been found that the amygdala, which is a small region in the brain below the hypothalamus with connections to the prefrontal cortex, plays a role in many types of anxiety disorders. Using fMRI studies, it has been observed that there is an increased amygdala activity in patients with anxiety disorders, and also that if you increase the stimulation of the amygdala, it leads to the symptoms of anxiety. All of this suggests that the failure of the prefrontal cortex to control the activity of the amygdala may be responsible for anxiety. Now, there is a chemical in the brain known as GABA which attaches to GABA receptors to decrease the activity of the amygdala, therefore reducing anxiety. Now, getting back to Xanax. Xanax attaches itself to a different section on GABA receptors to enhance the action of GABA, meaning that if GABA attaches itself to a GABA receptor with Xanax already attached to it, the GABA works even better at reducing the activity of the amygdala and therefore reducing stress. The benefits of using drugs like Xanax is that they are safer than barbiturates, which are a different class of anxiolytic drugs. Xanax also works rapidly, meaning that it is useful in panic disorders and severe anxiety. Moreover, it can also treat insomnia, which usually comes hand in hand with anxiety. Unfortunately, with the rising popularity of this drug, due to how effective it is in providing an immediate relaxing effect, there has been a rise in its abuse as a recreational drug. It can provide a sensation of lightheadedness, detachment from your body, emotional numbness, and even an increased sexual drive. In higher dosages, it can even cause hallucinations in the user. Overdose of the drug can lead to slurry speech, a lack of coordination, disorientation, and confusion. It can have an amnesia effect and impair memory. It also slows down your breathing rate, and when mixed with alcohol can be even more dangerous, leading to coma or death. Other consequences of an overdose can include fainting, low blood pressure, and hypoventilation. Xanax is highly addictive and tolerance can be built against the drug, meaning that even higher dosages are required with subsequent usage to produce the same effect. It can be quite paradoxical that a drug that many teens and adults use to escape from the grips of reality and anxiety leads to a slippery slope of mental disorders, health effects, and addiction. If you have found this video useful, please subscribe to the channel and check out the other videos.